that if we don't do something now, our numbers are going to become much worse this fall, starting when school starts, and then even progressing even higher like they did last year when it starts to get cold. So I just want to call everybody's attention to things, action steps that everybody can take in the community to keep our numbers down. We want to keep our COVID cases numbers down. We want to keep people out of the hospital. We want to keep kids in school, in the classrooms to learn, and we want to keep everybody safe and healthy and reduce transmission. And so there are things that everybody can do, some non-pharmaceutical interventions that are easy for everybody to do that will keep our numbers down. So I just want to go over a few of those. So first and foremost, people can mask. It is very easy to mask, and that protects you and it protects the people around you. So just make sure that all Erie County residents wear a well-fitted mask when they're indoors in public places, and then when they're outdoor in crowded places, whether you're vaccinated or not. So again, indoor in the public, when you're going out grocery shopping, when you're going to the movies, anywhere indoors, it's not in your home, you need to mask. And then outdoors, if you're in a crowded setting like a concert or a sports game, there are other people around you, you don't know if they're vaccinated, please mask. Also, physical distancing is also very powerful to prevent transmission. So make sure that you put 6 feet of distance between yourself and the people around you and who do not live in your household. This is especially important for people who are at higher risk of getting seriously ill for COVID-19, such as our seniors, people who are immunocompromised, and pregnant women. Also, thinking about avoiding large events if possible. And if you do go to large events, make sure that you mask and you maintain 6 feet social distance as much as you can, even if you're outdoors and such as, again, as I mentioned earlier, attending a concert or a festival or a sports game, or even if you're with a small group of people, you have to make sure that you have to distance. Also, try to go to places where there is good ventilation. Ventilation is also a very powerful tool to prevent COVID-19 transmission. So outdoors is better than indoors, because also outdoors you have great ventilation. Also, try to go to places, if you have to be indoors, that have good ventilations, that are able to open up a window. So if you're in big crowds, like in restaurants or bars or fitness centers or movie theaters, that puts you at higher risk for COVID-19 because those are closed spaces and they may not have great ventilations. They certainly don't have open windows if they're indoors. Also, making sure that if you're in a bus or any type of public transportation, please make sure that the windows are cracked open. Even a little bit makes a big difference. Also, diagnostic testing is very important. People need to know their status if they have any type of unusual physical symptoms. So if people really need to be aware and self-monitor for even just like mild cold-like symptoms. What's scary about the Delta variant is that many times, people don't lose their sense of taste or smell until later on in the course, where they never lose their taste of sense or smell. So there are a lot of people walking around with a Delta variant, which is almost all of the COVID-19 cases in our community right now, and think that they have allergies or think that they have a mild summer cold, where they could actually have COVID-19. So please, if you have any type of unusual symptoms, any respiratory symptoms at all, please get a test. Know your status. It'll help protect you and it'll help protect the people around you. Also, travel has been a huge risk factor for COVID-19. We've seen so many of our cases in Erie County who've recently returned from areas in the United States and abroad where they have high COVID-19 rates. It's, especially in the United States in the South and the West. So so you might want to think about rescheduling your travel. If you do travel, make sure that you mask and social distance as much as possible when you're down there. And when you return, do us all a favor and get a COVID-19 test 3 to 5 days after you return, so you know your status and you won't infect the people around you after you return. So I think after that, I can open it up to questions.
Great. So I see a couple other media outlets have joined us since Dr. Burstein started to speak. So I'm going to start at the top of my list, which is Emily Stoll from the Clarence Bee. I can take you off mute right now.
I don't have a question yet, sorry.
Oh, that's absolutely fine. We'll go on to Fox Buffalo. Fox may not have any questions. I will go on to Harold McNeil
Yes, hello.
from the Buffalo News.
Hello. I was wondering, Dr. Burstein, if you had any concerns about the um, the increasing rate of hospitalizations for COVID patients in Erie County.
Yes, I'm very concerned about the increasing number of people hospitalized in our Erie County hospitals with COVID-19 diagnoses. And again, as I meant, and we said in our press release, as of August 25th, there were 111 patients admitted to Erie County hospitals with COVID-19 diagnoses. And so August 25th of last year, there are only 24 patients. And so we've seen a very consistent increase of the number of people hospitalized over the summer with COVID-19, where we should have been seeing a decrease. And so we know that it's only going to get worse because the hospitalization numbers follow the COVID case numbers. And so we have to do everything we can to keep those numbers down. Also, with people who do get infected with COVID-19 and they start to get ill, they should talk to their healthcare provider getting a monoclonal antibody infusion. Many of the hospital systems here offer these, and it can really, really boost your immune system and help keep you out of the hospital.
Thank you.
Okay, on to Jeff Rusack from WKBW.
Hey, Dr. Burstein. What do you think are some of the big reasons why we're seeing such a change in the numbers from last year when there wasn't a vaccine to this year now when there is a vaccine?
The Delta variant. That is what's different. The Delta variant of SARS-CoV-2 that is in our community is responsible for almost all of the COVID-19 cases that we're seeing in Erie County. The Delta variant is highly transmissible. It's as infectious as chickenpox to people who aren't vaccinated against chickenpox. So it is very, very contagious. And it is spreading very quickly, especially among our unvaccinated people, but also among our vaccinated. We know that the COVID-19 vaccines that we have available on the market are very effective of preventing moderate to severe illness, keeping people out of the hospital, and also keeping people alive, preventing the end game of death from COVID-19. However, we know that they are not FDA authorized or FDA approved to prevent infection, although they do have an effectiveness to prevent COVID-19 infection. The effectiveness isn't as high as we had hoped. So that's why we have to layer in other preventive interventions like masking, social distancing to make sure that we prevent any type of infection. But the Delta variant is what's different. If you remember earlier in the year when our COVID-19 cases started to decrease after a really tough winter, and we all thought we were out of the woods, the switch flipped all of a sudden in March, and we started to see an increase in cases, and that was because of the Alpha strain from the UK. And again, we continue vaccinated. People, I think, were very adherent to masking and social distancing and other interventions, and our numbers came down again. And now, unfortunately, with this new Delta variant that's even more contagious, it's twice as contagious as the other COVID-19 strains, we're back seeing rising numbers again, despite warmer weather and despite people not being in school. So this is very, very dangerous. Thanks. I think we can take another question.
Oh, yep, absolutely. I was just finding my mute button. Next on to WGRZ and Rob Hackford.
Hi, Dr. Burstein. Can you hear me okay?
Yes, thank you.
Okay. We've heard Dr. Fauci call this a pandemic of the unvaccinated, but, we don't often see numbers related to that. Do you guys have any sort of breakdown, or can you go into how many of these new cases that you've seen are among unvaccinated versus breakthrough cases?
Sure. Well, among about 40% of our new COVID-19 cases are among people who are fully vaccinated. So we are seeing a significant amount of transmission among vaccinated people. However, what I'm hearing from the hospital CMOs is that a small minority of their hospitalized patients are fully vaccinated with COVID-19. We have to talk to the hospitals to get those exact data. However, and also with our deaths, we're seeing over 90% of our COVID-related deaths are not fully vaccinated or unvaccinated. So again, as far as we know from national data and from our local data, the vaccine is very effective of preventing moderate to severe illness, hospitalizations, and death from COVID-19. It is somewhat effective of preventing COVID-19 infections. So again, 60% of our COVID-19 cases were not fully vaccinated or unvaccinated. However, we are seeing breakthrough. That's why the Centers for Disease Control and the FDA is going to recommending booster doses for people starting at the end of September to receive them 8 months after their second doses, just to boost up the immunity. However, I think that's why we still have to be on guard, regardless of our vaccination status, with this new Delta variant. Thanks.
Okay, next on my list is Shannon Ross, but I don't see a way to unmute, so I'm going to move on to Spectrum News. Spectrum, you're on. Spectrum may not have a question. Tom Puckett is also next on the list, but he had to step away for a second. I see WIVB, and I'm taking you off mute. WIVB may just be recording. I will go back up to the top with Emily from Clarence B. If you have any questions now.
Well, I was wondering basically for the Delta variant spreading so quickly, I know we're talking about schools reopening at full capacity. We're hoping those kids can stay in. What do you think are there any numbers on like the likelihood that schools are going to have to like close down or quarantine soon?
Well, we earlier this week we released our Erie County school guidance that is, I think, very strong and very powerful to putting in place non-pharmaceutical interventions that we know are effective and we know that can prevent COVID-19 transmission anywhere, including in the schools. So my belief is that if the schools are able to comply with our Erie County school guidelines, then they will minimize the risk of transmission of COVID-19 within the schools. I mean, we all have the same goals. We all want students in school, in person, to learn. So that is our primary goal. And that's how we wrote these guidelines, with that in mind. So we have, we're requiring masking. We're requiring some level of physical distancing. We're requiring screening in the morning before people enter the building to make sure nobody comes in sick, because we saw that last year, and that's how one of the ways we saw COVID-19 spread within the schools. And then we're mandating some special pauses from sports if there are cases, and then of course we're implementing or following CDC guidelines for isolation and quarantine of unvaccinated close contacts for quarantine, and then cases will be in isolation for 10 days. So we're really trying hard to follow CDC guidance, which are evidence-based, and also the American Academy of Pediatric guide recommendations. And so I think with those combined, if schools follow our guidance, then I think they're going to be okay and be able to stay open. I mean, we know that kids are going to be, and teachers will get exposed to COVID-19 in the community. However, our goal is to stop transmission in the school buildings.
Okay, next I'll offer questions to Fox Buffalo if they have questions. Hearing none, back to Harold McNeil from the Buffalo News.
Oh, I'm all set. Thank you very much.
Excellent. Down to Jeff from WKBW.
I know you touched on this earlier a little bit, but just kind of re-asking, really, or not really re-asking, but really mentioning it, is just the fact that we're getting so close to the fall and the winter, and we saw that wave last year. How critical of a point are we in, and how concerned are you coming into these colder months?
Well, I'm very concerned that our numbers will only increase when school starts, and there'll be another opportunity for transmission within a closed space with a large number of kids and teachers in a school building. And I'm also concerned that once it starts to get cold, like it did last year, the numbers will jack up. And already, we've seen what's happened in the South. Schools that were fully open in the South have had to close because of huge COVID-19 outbreaks because those schools weren't adhering to any of the non-pharmaceutical interventions like masking or distancing or screening for symptoms for people coming in the building. The hospitals down south where schools have reopened are full. Their children's hospitals are full. Their ICUs are full. I mean, I'm hearing that kids have to be transferred out of state to get the appropriate hospital care. We do not want that to happen here. We know what we can do to prevent that from happening, to prevent widespread COVID-19 transmission among our young people and in our community. But it takes a community. It takes every single person's effort to do everything they can to prevent infection, masking, social distancing, and vaccinated. For people who are 12 and up, everybody should get vaccinated. We have a very vulnerable population of our schools of children who are 11 and younger, even down to the pre-K levels that are not able to get vaccinated. And they are such a vulnerable population. And so we have to do everything we can to vaccinate for the people who are eligible to get vaccinated, to get vaccinated and act as a cocoon or a wall, a barrier of prevention because if the people around them are not infected because they're fully vaccinated, then those young vulnerable children will not get infected because they'll be protected by the people around them. So it's all of our responsibilities to do everything we can. That COVID-19 is not going to go away by itself. We just can't sit back and say, ooh, wow, that's too bad. Those numbers are high. We all have to take action by masking, social distancing, getting tested if we have symptoms, staying away from other people if we have symptoms, and do everything we can to make sure that all of us in the community, especially the most vulnerable who can't get vaccinated, stays protected from COVID-19. So please, we have lots of vaccine available in our community. We have lots of testing in our community. We have lots of masks in our community. So, and right now we have warm weather. You can do whatever recreational activities outside. So please do what you can. Take your part. Every single person counts because you do not want to end up as one of our statistics of COVID-19 cases. Thanks.
Okay, next, I think WGRZ and Rob Hackford.
So this is kind of a two-parter, Dr. Burstein. Talking about misinformation that you've seen, and included in that, has Erie County seen any reports of people using that equine drug that is reportedly able to treat COVID with some unfortunate effects down the line?
Right. Well, that is not something that we track by surveillance. However, I just want to caution people that if they're ill with COVID-19, they should talk to their healthcare provider. We do have very effective treatment for COVID-19 that will keep people out of the hospital with monoclonal antibody infusions. However, you need to talk to your healthcare provider about that. So, instead of buying something, on the street or online that has all these false promises, please talk to your healthcare provider, or you can go to an urgent care center and have a discussion about, how to stay healthy with COVID-19, how to stay out of the hospital.
Okay,
And
next, oh.
did I answer your questions?
Yes, thank you. Yes, thank you.
Okay, I had Shannon, but I still can't get that off mute. So going down to Spectrum News, which also might just be recording, and then on to Tom Puckett from WBEN. He put his question in the chat, so he may not be back, but he asks if we have seen an uptake in vaccine numbers since the FDA fully authorized the Pfizer vaccine, so which happened I think 4 days ago.
Right. So it's it's difficult to measure the the increase in just a couple days of vaccination uptake. However, what I can tell you is where we are with our vaccination rates in Erie County, so that we know that for kids between the age of 12 and 15, about 50% have received at least one dose of COVID-19. And for the 16 to 17-year-olds, where the FDA has fully authorized fully approved the vaccine, 55% have received at least one dose of COVID-19. Looking at adults, 69% of Erie County residents who are 18 and older have received at least one dose of COVID-19 vaccine, and about 65% of adults are fully vaccinated with COVID-19. So, that's good progress. However, with the Delta variant, we need those numbers to go up, and especially with the children, we need those numbers to go up so the kids can stay in school. One bonus for students, if they are fully vaccinated, then they will, if they are identified as close contacts, although we recommend testing and monitoring for symptoms, and of course everybody will be masked, they do not have to quarantine, so they can stay in school even though that they are close contacts if they're fully vaccinated. So that's another kind of added bonus for students to start that vaccine series today.
Okay, so does anyone else have any questions that, or anyone that I didn't get to? I think you can take yourself off mute for this. Okay, if not, I'll just say that if anyone has any questions later on, please feel free to contact me. You all know my email, and that's the best way to get in touch with me this afternoon. And I thank you for joining us on relatively short
I
notice.
think there was one more question. Do I have any concerns about the Labor Day holidays?
Sorry, that just popped up.
Yes, thanks, from Emily, from the Clarence B. Yes, I do have concerns about the Labor Day holiday. They're gonna, usually Labor Day, people gather to celebrate the end of the summer, or more in the end of the summer season. However, again, it's you have to think about gathering with the Delta variant, and even if you're in a large crowd outdoors, I mean, you're still in a large crowd and could be exposed to many people's respiratory droplets, and if somebody's infected with COVID-19, you may get infected. So also people travel during the Labor Day holiday. So again, if you're traveling, especially out of state to areas where they have high transmission, please be careful. Maybe you want to think about rescheduling that to later in the year or next year, when hopefully our COVID-19 numbers are down. But we're any type of gathering can be a risk. Outdoors is less risky than indoors. Smaller gatherings are less risky than larger gatherings. So I hope people keep in mind when they're planning their activities for Labor Day. And also, I just want to suggest to the media that they reach out to the hospitals, see what they're seeing. What I hear from my colleagues in the hospital is they're working so hard. They're getting burnt out with all these admissions of really sick people. ICUs the beds are filling up, and seeing people die in our community from a preventable death is so sad. So I encourage you to reach out to the hospitals, see what they're talk to them about what they're seeing and what they think that our physicians in our hospitals think that Erie County residents should be doing to protect themselves against COVID-19.
Great, and with that, I think we can end our programming this afternoon. Thank you, everyone, and have a great weekend.
Thanks. Stay safe.